First, when I bring a cassette back, I'm going to make sure I have the patient and the different the exam I'm going to do up here. I would take the knowing which one it is, make sure it's highlighted, scan it, and then insert, and let it run. And bring it up, and then so for this. For a chest, want to go ahead and take a look and make sure I have 8 to 10 ribs, costophrenic angles, and that the heart, basically esophagus, is superimposed over the spine, and by no rotation, there's equal distance on the sternoclavicular joint. For a lateral, I want to make sure that the posterior ribs are superimposed, seeing the posterior and anterior shadows of the heart, around the heart, having the heart, making sure that the arms are out of the way with a PHS, making sure that the scapulas are out of the lung fields. For a sunrise, you want to have make sure that you get a nice patellofemoral joint spacing in here. These ones are not exactly, they're out of place, but with the sunrise, you can do a bilateral, which is this, or a unilateral, one knee at a time. And for a knee, here's an AP knee. This would be a repeat because of the fact that there's no joint spacing here on the medial side of the knee. Making sure they got the tibial plateaus in the here. For a lateral knee, you got to have the spacing for the patellofemoral joint, along with the fibula-tibial joint, and the head of the fibula is going to be somewhat imposed on the posterior side of the tibia. And then for the lateral medial oblique knee, the basing is having the tibia fibula, the head of the fibula and the proximal end of the tibia separated out. So there is, you see the joint, this tibial-fibular, the proximal tibial-fibular joint is not superimposed at all. And then at the patella is going to be at least two-thirds of the patella is going to be superimposed on the medial condyle and epicondyle. And then for the tunnel, or the capnometry Buclair, you're looking at the intercondylar fossa, which is going to be right in the center. You're kind of looking for any kind of artifacts or in bone chips or anything like that. And you're going to be looking through that. That should be it. Should be all of the 5 covered.